I'm pleased to be joined today on Health Beat by Dr. Jordan Ochs, orthopedic surgeon with Faith Regional Physician Services, Orthopedics. And today we're talking about direct anterior total hip replacement. So Dr. Ochs, tell us a little bit more about this approach to a hip replacement.
Yeah, the total hip replacement is one of the most successful procedures that we have in modern medicine today. The success and satisfaction rate of hip replacement is greater than 95%. And this positive impact that can have on a person's quality of life is one of the primary reasons that as an orthopedic surgeon, I pursued additional fellowship training in joint replacement. In particular, I'm passionate about the direct anterior approach. The direct anterior approach utilizes an incision in the front of the thigh, typically around 4 to 6 inches. One of the benefits is that the diseased hip can be accessed by passing between the muscular planes as opposed to through the muscle itself as we use in more traditional approaches. Effectively, this minimizes the amount of surgical trauma to the surrounding tissues, and it allows for quicker patient recovery, even to the point that today many patients can leave the hospital the same day as their surgery. The post-operative precautions we take after anterior total hip are less burdensome, and overall there's a slightly lower risk of instability or the prosthetic hip popping out of socket. The combination of this and the modern advances we've made in our implant bearing surfaces means that for many patients that have a total hip done in today's day and age, it'll last them the rest of their life.
Having that quality of life through this procedure is just fascinating. It seems to me.
Yes, it is. And it really is, for me, satisfying to see how quickly people recover.
Yeah. Well, thanks for sharing that with our viewers. I'm sure they're going to appreciate it.
Thank you.
You bet. And that's Health Beat, brought to you today by Faith Regional Physician Services.